senior system, which is one of those that's recognized by the Constitution.
Ground Zero Season 2, live and syndicated on your public and national broadcaster, UBC, inspiring Uganda.
Don't miss UBC Radio Ground Zero every Saturday from 10 a.m. to 12 p.m. We host credible and relevant guests to discuss pertinent issues of national importance aimed at addressing people's concerns.
As a country, if we don't fight this vice of corruption seriously and with honest opinion without any bias, things will not be good for us.
UBC Radio Ground Zero, right here on UBC Radio.
UBC, ensure that the information you give out is factual but also objective, balanced, and complies with the legal and policy requirements for the media.
Ground Zero program is always live, loud and clear, every Saturday from 10 a.m. to 12 p.m. on UBC Radio, Butebo FM, West Nile FM, and Magic 100 FM, and live stream on YouTube. You can also listen to the repeated broadcast of UBC Ground Zero every Sunday from 3 p.m. to 5 p.m. UBC Radio, inspiring Uganda.
Welcome to Ground Zero Season 2, a show that brings you in-depth discussion ranging from politics, health, finance, sports, and so much more. Ground Zero Season 2.
Yes, indeed, it is indeed UBC Ground Zero, and we are here to inspire you, the people of Uganda. It is a great honor to welcome you to this important engagement and edition of UBC Ground Zero. We are live on 5 radio stations that cover this program live, and we're streaming live on YouTube. You just put UBC Radio or UBC Ground Zero, and you'll be part of our conversation. And Ampaire Amon of Buteega is my name, as we wait to join the rest of the world to commemorate World AIDS Day on 1st December and also International Day of Persons with Disabilities. These two global observances remind us of something that is deeply connected, and also we are going to look at how the two are connected and how significant they are to the people of Uganda and also to the global citizens, especially to do with how dignity, inclusions, and also looking at fundamental human rights and not to be left behind. This is a national broadcaster, and we are here to serve every Ugandan. Today, we are privileged to host leaders who have devoted their lives to advancing their rights for persons with disabilities in Uganda, and especially those that are concerned about how they need to be treated well in our communities. I'm having a very special team of guests, and I expect more to join, but currently do have a privilege to have James Mwesje is the member of National Council for Persons with Disabilities, is the member of MOVE's Council, and also their vice chairperson. I want to take this very special honor to welcome you, sir, to this important edition of UBC Ground Zero.
Good morning, listeners, and good morning, Ndugu Amon.
Indeed, good morning, and we want to welcome you. Cannot take that for granted. Thank you for sacrificing your time to come and speak to the people of Uganda, educating them, inspiring them, and informing them on UBC radio platforms. And we are here for that very cause, to make sure that the people of Uganda are indeed inspired. We also hope to be joined by Chozira Esther, is the CEO National Union for People with Disabilities in Uganda. Many of you know it as NODIPU, but also we expect to be joined by Flavia Chomkama, is the executive director coming from one of the significant platforms and organizations called the National Forum of People Living with HIV and AIDS Network in Uganda, and is going to be telling us what do we need to do to help ourselves, especially those that have the virus. And we want to also know that there are those people who with disabilities and are very so much affected by the virus, and want to see how they are being helped in our communities, but also want to see how with disabilities are engaging in wealth creation programs, which is a key to socio-economic empowerment of persons with disabilities in this country we call home. In this country we call Uganda. So that is in our direction and our discussion today. As we reflect on World AIDS Day, we are reaffirm our commitment to ending the stigma, expanding access to services, but also we are recognizing that persons with disabilities, especially women, youth, and the blind, face unique barriers, especially in the fight against HIV. And looking at this year's theme, which is going to be discussed in this forum, calls upon all of us to strengthen community leadership and also ensure that disability inclusion is not an something that we cannot take that for granted after thought, but also a foundation and a basis for all of us in our communities to have our HIV response. And also, as we approach the International Day of Persons with Disabilities, we also celebrate them and also celebrate their achievements. We celebrate their resilience and also the contribution of persons with disabilities in Uganda. It is the day that we're going to be recognizing their progress, but also how they are confronting the gaps in the accessibility, in the employment, in education, and also one of the most sensitive but very unique is healthcare. Today's conversation is an opportunity for all of us. Just come close so much to your radio and let's have this engagement. Let's have this chat, and you can always participate and share your views on 776-511-426. The number you can reach us on is 0776-511-426, and you'll be able to share your comments and also your views on what you think needs to be done to improve our communities, to improve our societies, and also this country, that we can learn the challenges by ourselves, to amplify voices, to shape a more inclusive Uganda, where everyone, regardless of their status, regardless of their ability, regardless of their health status, can live with dignity, opportunity, and hope. Let's waste no time. I come to you as a leader. I come to you as a person that you have lived with disabilities, and also those that are in our communities, and also at the National Council. For those that have had the National Council for the very first time, what do you do? What is your mandate, James? And how far have you gone in fulfilling that very noble mandate, especially serving the people of Uganda?
Thank you, Amon. Like you said, my name is Amos James. I'm a member of the National Council for Persons with Disabilities. And thank you for giving us the opportunity to be here to share with members of the public what the National Council is, and what we are doing, and how far we have moved in responding and realizing the objectives or mandate for which we are established. The National Council is a government body that is responsible for monitoring the various activities of various institutions and agencies, be state agencies or non-state agencies, in respect to responding to the needs of persons with disabilities. The National Council has several functions, but before I say that, it is headed by a council whose membership is attracted from a cross-section of persons with disabilities with various categories for purposes of reaching understanding of what needs to be done for them, and also ensuring that they are fairly represented when we are talking about their needs and ways of how they can be met. The membership is constituted of about 15 people. But we also have ex-officials from ministries such as the Ministry of Works, Ministry of Education, Ministry of Health, Ministry of Communication, and these are meant to provide input in terms of information, data, and also designing interventions within your specific sectors to respond to the needs of disabled persons that have been presented to those sectors. There are 14 functions, and if you don't mind, I can read some of them.
Please.
I can go ahead. Okay, thank you. One, there are 14 of them, and one is to monitor the implementation of this act by government agencies, non-government agencies, bodies, corporate and private persons. Carry out or commission surveys, inquiries or investigations on matters relating to violation of rights of persons with disabilities under this act, or non-compliance with this act by government, bodies, corporate or private persons, and advocate for collective measures by the concerned parties. Advocate for the development, implementation, and sustenance of programs and projects by government agencies, non-governmental agencies for the improvement of the welfare of persons with disabilities. Develop projects and schemes for self-employment or sheltered employment for persons with disabilities. Establish programs for the support, counseling, and other assistance to persons with disabilities, and for the parents, guardians, and caregivers of persons with disabilities. Monitor the welfare and the rehabilitation services offered by government agencies, non-governmental agencies, including vocational guidance and counseling. Regulate the human support services for persons with disabilities, including sign language interpreters, readers, guides, and life assistants. Liaise with government on the needs, problems, and other issues of persons with disabilities for planning purposes. Mobilize with disabilities to participate in elections, sports, and other co-curricular activities for persons with disabilities at all levels. Alleviate blindness by raising awareness on the prevention, early detection, and the treatment of eye diseases to prevent the welfare of the person with disability with vision disability. Advocate for the education, training, and employment for persons with visual disability. Maintain a register of government and non-governmental organizations that provide services for the rehabilitation and welfare of persons with disabilities, and the membership of those organizations. Provide technical and other forms of assistance to government or any other person on issues of persons with disabilities, and perform any other function as may be necessary for the purposes of this act. So these are the functions of council. You did also say how far we have gone in responding or ensuring that some of these things are achieved. The National Council, first and foremost, as like I indicated, has been instrumental in raising awareness on these matters, the needs of disabled persons, what requires to be done. And for the information of the public and other listeners, to respond to disability, one has to have an understanding of what disability is in respect to the impairments and the barriers in the environment that the people with impairments relate to, and which therefore leads to a disability as a result of the inability to cope as arising from that relationship between the person with an impairment and the barriers in the environment. An example I can give is for someone with a visual impairment. Now, the person with a visual impairment is a person that cannot see. He is blind, to use our traditional word. To use our traditional term, the person is blind. And because the person is blind, cannot read the texts as written. The written text, the person cannot read that. So what happens is that to remove the barrier, the person is given knowledge and skills to read what is called Braille Braille are protruding dots on a piece of paper that convey a meaning, and it can only be read by those who have been trained and acquired the skills in Braille writing and reading. So once this person now is able, once a given text is printed in Braille on another piece of paper, then the person with a visual impairment can read. In so doing, you are actually reducing the disability. You are reducing the inability to read, the inability to know, inability to go to school and to communicate with other people. The same goes with the people with the hearing impairment who you cannot communicate with unless you use sign language. So sign language in this case is the means by which the person can now hear, understand what you are doing, and arising from that communication, then you would agree on what it is that you want done. So in so doing, you are reducing the impact of the impairment on the individual with that impairment who happens to be a hearing impaired person, and also the other member of the public that would have wanted to communicate with this person but cannot. If you go to the physically handicapped people or physically impaired people who have challenges in mobility and either use wheelchairs or crawl on the ground or use crutches and other means of moving around. So if those people are not given those gadgets to minimize the impact of the impairment, it would be difficult for them to move around, and as such, they would therefore be considered unable. So a disability arises from a person who has an impairment and the challenges or the barriers within the environment, which leads to a person being unable to do one thing or another as expected by him or herself or by the public. So we're explaining this so that people can understand. One other thing we have done in respect, for example, to making persons with disability access services provided by various institutions and in government programs is to visit institutions and talk to them the importance of accessibility, of making their places accessible, their services accessible, so that the persons with disabilities, irrespective of their disabilities, can also participate and enjoy the benefits provided in those services. We have also been writing reports on what we have been doing so that people can know that there is progress that is being made. And these, once they have been compiled, they are sent to Parliament. We also write reports that are discussed at the UN in respect to the progress that we have made in responding to the needs of disabled persons.
Interesting. I've started to learn a lot, and I am glad that you're serving the people of Uganda in that way. And many people really never knew how you do, and that also those that have been victims, it is very important that you know and get this kind of information to make sure that you move together as the people of Uganda. We're talking about wealth creation, James, and we're wondering how National Council is helping those who are disabled in our communities to access government programs, to access government services. How are you helping them?
Thank you, Amon. Wealth creation for persons with disabilities, I would like to start by explaining what wealth creation is. Wealth creation is a government program that has a number of activities or services that are required to enable the people of Uganda increase their income levels, particularly at the household level. And one of the programs is called Operation Wealth Creation, which is a presidential initiative launched in 2013 to transform subsistence farmers into commercial farmers through the distribution of agricultural inputs and technologies technological upgrading. Other initiatives that one could talk about in respect to wealth creation is the parish development model, Myoga, the youth fund, the women economic empowerment program. All these are programs in which government puts money so that people with disabilities, the poor people in our communities, the youth, the persons with disabilities, like I said, must go access funding, access support in terms of skills and knowledge, and then be able to undertake various economic activities. Be it could be coffee growing, it could be goat skipping, cattle, zero grazing especially. It could be poultry keeping, so that these people can raise money that can help in responding to the needs in their own homes. For example, the National Council, we have been engaging with the government, the PDM Secretariat, and other stakeholders down in the local governments, at the sub-county, the district levels, to find out whether people with disabilities are participating. And the good news is that they are participating. Of course, there are challenges, but any undertaking comes with challenges, and it is the duty of leaders to find a way of how to respond to them. So we are doing something about enabling people with disabilities, enabling institutions that are in charge to engage, to improve the quality of people, persons with disabilities, by enabling people with disabilities to access these wealth creation programs.
Interesting. Thank you so very much, James. A privilege and honor to have the CEO of National Union for People with Disabilities in Uganda. Chozila, thank you for making time to come through, and this is UBC Ground Zero. We should be your home. UBC Radio is always here, and also I'm glad that you've spared time to come and talk to the people of Uganda on this forum. You're most welcome, madam.
Thank you.
How Dipu?
No, Dipu, we are fine.
Interesting. One wonders, what have you been doing? What is keeping Nodibo very busy, especially in this season? I know you have been in 2 elections, and one wonders how you've been participating. How has the season treated you?
Nodibo, we are doing so many things. We recently have been celebrating our 38 years of existence. We had a marathon, and where we were fundraising for artificial limbs for persons with amputation. Then we went to Hoima to create awareness on the right to inclusive health services. And when it comes to politics, the season is still on, and we are mobilizing our persons with disabilities to ensure that they go through all the levels of election until we conclude it next year in January. And one of the challenges we have been getting is the masqueraders, people who want to benefit from the positions of persons with disabilities, yet they don't have a disability. These are many across the country, and these are cases we are dealing with on a daily. And I think going forward, we may want to request the Electoral Commission to continue verifying some of these, because when they are not verified, the right persons with disabilities are left out, and those who wish to be persons with disabilities take over the positions, which is wrong. And yet when persons with disabilities try to go and contest in the mainstream, they are always told, you have your positions, don't come this side. So where should persons with disabilities go? And that is a big question. Yeah, but generally, so far so good. Persons with disabilities are participating effectively, and we have not found any major challenges so far.
Interesting. Thank you so very much. And we've been talking about the National Council. You found James talking about their leadership, what they do, especially in serving the people of Uganda. And one wonders what is the distinction between the National Council and NODIPO. What services do you provide that at least will go beyond to the National Council? And we're also talking about wealth creation, government programs and projects. How is NODIPO helping people with disabilities to make sure that they benefit from these programs?
I would start with your first question of what is the difference between NODIPO and National Council. And this is a thing that confuses many people, those in government and out of government. NODIPO is a national umbrella organization of persons with disabilities. This means that these are persons with disabilities themselves who came together to form an organization that advocates for their rights, that speaks for their issues, and it is comprised of persons with disabilities. And we have member organizations that are focusing on specific disability categories. For instance, we have an organization for persons who are blind and visually impaired, that is UNAB. We have an organization for people who are deaf, that is the National Association of the Deaf. Then we have an organization for persons who are hard of hearing. We have an organization for women with disabilities. We have one for youth with disabilities. We have 3 for persons with albinism. We have for persons affected by dwarfism. We have persons with epilepsy, persons who are deaf-blind. All these are the ones who come and form NODIPO as their umbrella. Although each of them is semi-autonomous, they do their activities, they do their advocacy, and then we come together when we have so many issues that affect persons with disabilities. On the other hand, the National Council is an institution that was established by an Act of Parliament, and it's supposed to provide advisory services to government. To say, for instance, Operation Wealth Creation, our people with disabilities are not benefiting. Where is the problem? Operation Wealth Creation, National Council, how do you guide us to ensure that persons with disabilities benefit? For me as NODIPO, I'm supposed to collect the issues from the persons with disabilities and take them to National Council and say, I was in this district, 100 people have not benefited from Operation Wealth Creation. Efforts are being made, we are not seeing any progress. So National Council is supposed to pick it from there and go and face Operation Wealth Creation. Or they can even say, NODIPO, come and we go. So they speak on our behalf and advise government on what needs to happen. Now, the challenge in some districts, even sometimes at national level, we end up mixing up our roles. And because we mix up the roles and the mandate, we get confused, and many times services are not delivered to the people. But we are supposed to work hand in hand with the National Council because it represents us on the side of government. On our side, we are a non-government organization, but we work closely with government. I hope I've been able to put that difference.
Indeed.
Yes. Then in terms of the programs that we do, we are more of an advocacy organization that looks at policies, programs, and ensure that these policies and programs are targeting persons with disabilities, both in government and in civil society, because we know that the actors come from all over. But our role is to continue amplifying the voice of persons with disabilities to whoever must listen to it. And if we see that they are not listening, now we run to National Council and say, hey, these people are not listening to us. Yet we have made the noise, we have written the petitions. So National Council is supposed to quickly jump in and say, here we are. why aren't you listening to Nudipu? Maybe this is what we need to do to address their concerns. And that's what needs to happen. Then you asked another question about health question.
Yes.
You could ask that question again.
I was wondering how you're helping people with disabilities to benefit from government programs and projects, which I do believe that there is a percentage that has been allocated for them, especially to do with Myoga, with PDM, with all the government funds.
Yeah, including the special grant for persons with disabilities.
Yes.
Yes, we are doing a number of things. One, we are mobilizing them at the community level to inform them about these programs, because it's one thing the programs to be there, but it's another for persons to benefit or to even know that they exist. So our associations that are based in the villages, in the parishes and sub-counties, we encourage them to register their associations first of all, because government normally works with groups that are organized and registered. So we have encouraged many to acquire the CBO status with at the district level to enable them benefit from these programs. Then two, we are also building their capacity in how to utilize the resources they get from these programs. For instance, we know that under the special grant, many of them are supposed to start businesses and do income generating activities that can help them generate income and improve their household levels. But then you find that someone gets the money and they just go and they celebrate Christmas or they distribute amongst themselves. That's what we used to find at other communities. So what we do is to show them like, yes, this has been given to you as a seed to start improving yourself. So we take them through financial literacy and business management to make sure that they benefit from some of those programs. Then also we build their capacity in group dynamics. Someone can go and get money, gives each of them transport that brought them to the bank, and disappear with the other money. But these are persons with disabilities whom you think they understand the situation of their colleagues and the reason why the money is being accessed. So we keep empowering them to say, no, don't take the money because there is a reason why you applied for it. And that is the role that Nudipu mostly does. And under PDM, it's the same thing. We have been bringing the persons with disabilities to understand how the program works, but also we bring the technical people who are managing the PDM grants, especially the parish chiefs, to take them through disability inclusion. What does it mean for a person with disability to do the projects that you are saying of crop, husbandry, and any other things that the group chooses? How does a person with disability manage that program that you have brought up, because they have challenges? Because previously, when PDM was coming, it was like, you must choose a project maybe on growing beans at that level. Then you don't know what disability does this person has. Is he or she able to grow the beans? If they are not able, what are the alternatives? Can we make it flexible to groups that are vulnerable and have challenges? And at first we were told, this is how the program was designed, nothing can change. But we want to appreciate that progressively, as we have been creating the awareness, there is some flexibility here and there.
Interesting. Our dear listener, this is UBC Ground Zero. We are on 5 radio stations that cover this program. UBC Radio in Kampala, Magic 100 FM in Kampala, UBC Western Nile in the heart of Alua City, and we're also on UBC Butebo Radio covering all the parts of Eastern Uganda. We are on Voice of Wonderbujo, and we are also streaming live on YouTube. You just put UBC Ground Zero and be part of the conversation. Interesting, you can as well participate in our program as 776-511-426 is the number you can call or send your messages, and in the next hour. We are going to be sharing your views and also reading out your comments. And we continue with the discussion. Allow me come back to you, James, and especially on the National Council. Looking back where you have come from up to now in your service and serving the people of Uganda, especially those with disabilities, what are some of your achievements? I understand that the Day for Persons with Disabilities, International Day, is just in the corner. Is it 3rd December?
December.
Okay, where Uganda is going to be joining the rest of the world to commemorate and celebrate this day. But what, as the people of Uganda gather, especially those with disabilities and all in our communities, what are some of the achievements that we can say, well, at least this year or the past years we have celebrated and we join the rest of the world in 2025 with these kind of goals that we have scored?
Yeah, Amon, I think you will allow me to borrow the word that is being used by NRM here. NRM is talking of protecting the gains. And if you look what has been achieved in as a disability fraternity, whether we are talking of the council, whether we are talking of Butebo, we are talking of even other players, the development partners that have been investing in disability, there is a lot. First and foremost, in 1995, for the first time in this country, people with disabilities became people like other people with rights that can be promoted, protected, and enjoyed. So that was a very big achievement that laid the foundation for a legal frame that would respond to the needs of people with disabilities in this country, but also enable people with disabilities in their movement of disabled persons to participate internationally in terms of what is going on in respect to the various undertakings of other nations and also at the UN. So the other thing is that we can now talk of a robust disability movement in the country, headed by the National Union of Disabled Persons of Uganda. The CEO has told you what Butebo is. Initially, disabled persons used to exist as independent in independent organization, and each organization would be talking about its own things and so forth. But the movement under Butebo became one voice to champion the rights, the needs, and the required intervention that would be carried out to respond to their specific needs and other strategic needs as well. If you go out in the sub-counties, in the parishes, in the villages, there are structures through which people with disabilities are represented, even at the national level in parliament. Disabled persons have their political representatives at those levels of governance, and the purpose is to ensure that the voice of disabled persons is reflected in the plans, in the policies, the laws, the plans, the budgets, and the monitoring mechanisms that are developed within government. And you can't take that for granted. That has been the biggest, we could say, in terms of participation and involvement of disabled persons in affairs that pertain to the running of our state. The other achievement is in respect to if you want to liberate disabled persons, you have to invest in providing knowledge to them, skills to them, before you even talk of these other opportunities that they can take advantage of. So what happened is that the higher institutions of learning, the public universities have slots for admitting students with disabilities. As long as you have two principals, you can join any public institution and get your knowledge, your skills, and your degree, and join the people who we consider to be knowledgeable in this country. And this has also opened an opportunity for them to acquire jobs in government institutions, in the private sector, but also to ably decide on their own the kind of activities they can engage in from an economic empowerment point of view, where they would carry out their own things and generate money and be able to survive. And it is difficult to give skills to someone that has not been to school. So the fact that disabled persons have been enabled to go to school, to acquire these big certificates, is an opportunity in itself. The other achievement I could talk of is our ability to have even a representative at the executive level, where we have a minister who is our voice and our champion in respect to ensuring that needs of disabled persons, whenever government at the cabinet level is planning whichever plan it is coming up with, whichever interventions it is working out, that the needs of disabled persons are talked about. In this regard, going back to what the CEO Butebo said of the special interest group, at one point the special interest group funding had been slashed to very miserable levels. But because we have a minister at that level who advocated and argued our case, the fund was restored. We now talk of 16.5 billion shillings that disabled persons can benefit from. The special grant is a grant that could be used to address two things. One is to enable disabled persons engage in economic activities, but also in some instances it has been used to procure assistive devices that could enable people with disabilities manage their impairments and therefore promote their participation in whichever programs or activities that are going on, including governance. So on our part, I think we are doing very well.
Interesting. I'm glad that at least we have made that progress.
Amon, I could add this.
Please.
When you talk of governance, political governance especially, you are talking about people being involved in discussing and deciding their strategic, being in the politics of a given country. So we have been participating, just like my CEO mentioned. The fact that disabled persons are now all over the country, just like any other politician in this country, increases the visibility of our cause, increases the desire to understand why disabled persons have to be part of these processes, and justifies our democratic practices from a participation point of view, and which ensures that the voice of every person must be heard. So this is great on our part. We know there are challenges, but like I said earlier on, challenges are there to be resolved.
How are you helping Butebo? I don't know whether you have encountered that challenge as well. Masqueraders, Josira has talked about masqueraders, and they are flooding all these positions. They are trying to leverage on every opportunity that has been granted to people with disabilities. As a national council, how do you come in to help and solve this challenge?
Yes, masqueraders are not new. You remember the Odoch Commission, which facilitated our having a new constitution, 1995 constitution. There were consultations going on, and Butebo, through the Butebo board and our executive director at the time, the late Honorable Faz Mazima, we instructed him to write a letter to the Odoch Commission and seeking an appointment to justify why we needed to be part of the process. And what happened was that the Odochi Commission granted us one slot. And they said, you give us one person that is going to represent you in this process. Now, the moment that one was said publicly, many people came up, even those that I never wanted to identify with our cause, who to go to and say, please come and join us so that we give this thing the strength it requires so that we are heard. I tell you, wherever there are opportunities and opportunities of that magnitude, many people will come up pretending, even those who are not even, they would just come up. So have people who are bald-headed, even those who have lost a tooth, who have lost one finger, even those who have stomach pain. They will come up and they will say, we are also persons with disabilities. But the definition of disability is very clear. It must be a long-term kind of impairment, not short-term, which is like an illness which you can treat and it goes. Now, so many people have come up, and they always come up during this time of elections because of those positions like I talked about. So what has the National Council been doing? The National Council, like I did indicate to the public, to the listeners, one of the functions is to work with the Electoral Commission to facilitate participation of people with disabilities so that it is easier for them to access the voting places, the materials, the civic. So we engage in civic education together with the Electoral Commission. We also encourage other people, Nudipu, to talk about our participation as well. Now, there are many petitions that have been coming to us, either through the Nudipu membership or from the Electoral Commission, about people who are coming up and saying they are also disabled persons when they are not. And we have been going out, or sometimes we invite them, or we engage expert people to tell them whether they constitute to be disabled persons or not. And that in a way has helped, but I want to tell you it is quite challenging. In some instances, there are those who say, no, we are people with disabilities. And when they insist, we say, okay, go and sort it out. But and that's why we do civic education, to let people know who is a person with a disability, and so that they don't get these masqueraders to represent them, knowing fully well that once they get there, they may pursue their agenda and ignore persons with disabilities. So, but we trust that people with disabilities themselves, who are the voters, at a particular moment when the time comes, they will elect the right people into these positions. And the disabled persons that are aggrieved can actually petition. Mm-hmm. And there are forums where this can be sorted out.
Interesting. I am glad that you made that very clear, especially the definition of of disability. But I don't want to expect people to start cutting their toes and fingers to be able to come through in those positions and be able to take advantage. I come to you, CEO, and looking back at some of the achievements that James talked about. I know you also have a number to celebrate, but going back to programs of government, people here in town seem to be so much informed. Access to these services seems to be easier for them, but there are those who are deep in the villages and who are leveraging on local communities, local councils, local leadership, and the local government as well. But how do you strengthen your structures right from the LC up to where you sit in Uganda's capital, Kampala, to make sure that you speak the same voice? Even those who are in the villages, Kabera Maido, Kisoro, Bosia, are also benefiting, like those who live in Makindye, Nakawa, and many other established communities.
Thank you, Amon, for that wonderful question. NUDIP is across this country. At least if you went to every village, every parish and sub-county. But the level of engagement may differ. We have made sure that the message of the government programs reaches everyone and everywhere. But the challenge is that in some communities, some people are more empowered than the others, especially the councillors for persons with disabilities who sit in the local government councils. They have the information, they have more information than their colleagues who are in the sub-counties and the parishes, and this is a challenge. Would have expected that when they get this information, they disseminate it to their colleagues who are not sitting in the same space. But sometimes you find that this is not happening. And their reason also is that they are not facilitated to go down to the communities to disseminate the information. So they rely entirely on the community development officers to disseminate the information. And because of that, we are not sure whether the CDOs are sending the message specifically to every person with disability. And that is still a challenge, which may not be for only NODIPU, but for everyone who is wanting these programs to reach the community. So what does this mean? It means that NODIPU National Council, PDM Secretariat, the Myoga Secretariat, everyone who is interested in making sure that we improve the wealth creation for persons with disabilities must do something. Many times when messages are being sent out to the communities for an awareness activity, it's unlikely that you'll find a sign language interpreter, for instance, at the district level or sub-county level to give information to people with hearing impairment. And it's also unlikely that you find them mobilized anyway to come and benefit from this awareness activity. And as a result, the information is lost. And that's the reason why you find that many in the rural communities may not benefit because they are not informed, they are not aware. Recently, I was in one of the districts and they were telling them that if you take the PDM money, you are going to be arrested because that is government money. They will come into your house, they will take all your property because and we find at the community level. So we had to ask the DCDO to come and sensitize them about how the program works and why they wouldn't be arrested. So the lack of information to these rural communities is a big challenge, and it is not enabling many persons with disabilities to participate. But also the lack of information in accessible formats. As I said, sign language interpreters being brought into the awareness sessions, visually impaired people with mobility challenges being mobilized to come and benefit from the information on how they can benefit from programs is missing. And once that misses, you may not expect many people with disabilities to participate. Then the fear for risk taking by persons with disabilities. Someone's like, we hear those are loans. I don't see why I should go for a loan. So they'd rather remain in their poverty, but not to go for any of these government programs, because they know when they fail to pay back, it's going to be a problem. So there is more awareness that is needed and specific mobilization for persons with disabilities if we want to see them improve in benefiting. There's a 10% that was allocated for persons with disabilities in PDM. What we have found is that the parish chiefs who are supposed to identify persons with disabilities actually lack the knowledge of knowing who a person with disability is. Even when we are showing them the Persons with Disabilities Act of 2020 that has a very clear schedule outlining who a person with disability is, they even go down to break it down and say physical disability, the following are the people we consider. They are not using that. So you go to their information management system when you can't see numbers for persons with disabilities. And many of them have put there, yeah, we have reached the 10%, but when you go down to unpack this 10% and say, okay, which disability does this person have, that will not come out. They will tell you, yeah, for us we captured him or her as a person with disability. So we are telling them, no, go down and put the categories so that we are able to identify who is benefiting and who is not benefiting. So the information management system for the different programs, not only PDM, need to be clear for us to be able to capture the right numbers and the right people with disabilities who are benefiting. Otherwise, because a district wants to score highly, they will say, yeah, we have already got the 10%. We have actually passed the percentage of 10%, but they cannot go down to defend that 10% they are claiming. Yet when you mobilize the persons with disabilities, they are telling you, no, we have not benefited here. The challenge is this one. And that is a problem. Then the other challenge is that persons with disabilities don't live alone in their families. And many times the policy says that if they pick one person in that family, then they can't come back. And now that poses a challenge. If I'm a person with disability who wants to benefit, if they picked my brother or my mother, it means that me as a person with disability, I will not benefit from the PDM. So those are some of the challenges which we cannot say every person with disability will be able to benefit from the programs until we address them. And as I said earlier, NODIPO is just doing a lot of awareness creation. We are mobilizing persons with disabilities, and we are reminding the local governments to always ensure that in the activities they are doing on these programs, persons with disabilities are not left out. And we are also building the capacity of the technical teams to understand what we mean by disability inclusion.
Interesting. Thank you so very much, CEO of NODIPO, Chozila and James. We're taking a very short break, and when we return, I'll be getting your views on 776-511-426. We do value your views, especially on UBC Ground Zero, and it is high time that you participate in this next hour through that very number, 776-511-426. And when I return from the break, I'll be also connected to Flavia Mkama, who is also helping communities is there. As we all know that 1st December is the day when Uganda and the rest of the world will be commemorating World AIDS Day, and I also want to see how that is also transforming communities, and also how people with disabilities are going to be helped in that kind of movement. And I will also put it to you, Chozira and James, how are you helping people with disabilities, especially those that have the virus or AIDS, to be helped and access those services, but also to be fitting in respective communities? Stigma is still remaining a challenge, so one wonders if they are being stigmatized on disability. How about if they go ahead and have the virus? I'm returning after this very short break, and UBC Ground Zero continues. Joy, and I'm coming back in just a bit. I pray that you don't go away.
This is Ground Zero Season 2. Stay tuned. We shall be right back. It's hot.
We passed it. We didn't know exactly what the problem was on the ground. There is no pretending about the effect of this thing. There's no pretending about it. Nobody should. It's a problem.
It's balanced.
This is not the stage at which you start planning to tax a commodity like coffee, especially from down there.
It's intellectually engaging.
The Constitution provides that the land must be registered under the customer tenure system, which is one of those that's recognized by the Constitution.
Ground Zero Season 2, live and syndicated on your public and national broadcaster, UBC, inspiring Uganda.
At UBC Radio, all our radio network across the country is committed to inform, entertain, educate, and guide for national transformation.
On radio, UBC should set its own example. Leka bano abatafa ku bantu baffe bagumaza ndowooza Muganda kita okuguumaaza, to divert people. Let our own UBC bring programs to educate the people so that abagala kuguumaaza babeereyo baguumaaza, naye naffe they can advise, guide. And people in time will judge the one who is their friend and who is just using them.
Tune into UBC radios for credible socio-economic programs. UBC, inspiring Uganda.
Every Saturday, UBC Radio broadcasts the Information Hub, your one-stop dial radio show. Join us to learn and know more information about innovations, research, and developments. The Information Hub, knowledge is power, on UBC Radio, inspiring Uganda.
World AIDS Day is commemorated annually on 1st December. Uganda will join the rest of the world to put HIV and AIDS into perspective in 2025. HIV remains a significant public health challenge in Uganda, with high infection rates despite progress in treatment and prevention. New infections are still a concern, particularly among young women, adolescent girls, and marginalized populations, as Uganda works towards the 2025 Global 95 targets and its 2030 goal for ending the epidemic. The overall HIV prevalence among those aged 15 to 49 was 4.9% in 2024, according to the World Bank. New infections remain high, with an estimated 730 new cases reported weekly, and the rate is not declining as rapidly among young people as in other groups. World AIDS Day 2025 celebrations will focus on the theme, Overcoming Disruption, Transforming the AIDS Response. The day will highlight the impact of funding cuts on HIV services and the resilience of communities. Bushenyi district in western Uganda will host this year's national commemoration on UBC Radio, and all its broadcast networks will relay the event live, loud and clear. UBC, inspiring Uganda.
Come on out, let's come together, fight AIDS in times of war, in times of sorrow.
This is our home, our land, our Uganda. From the rolling hills to the busy streets, from the farmers in the fields to the students in classrooms, we are one people. Elections are a time to choose our leaders, not to fight our brothers and sisters. When violence enters the ballot box, the future of our country is wounded. But when peace leads the way, our nation grows stronger. On election day, choose unity over diversion, respect over hatred, and dialogue over distraction. Love your country, protect your fellow citizens, stand for peace, and say no to electoral violence. This message is brought to you by the Global Election Observation Mission, GEOM, in partnership with the Uganda Electoral Commission. Informed citizens, strong nation.
Welcome back. Ground Zero Season 2 continues.
Yes, this is UBC Radio. We are live on 5 radio stations that cover this program. We are on UBC Butebo, covering eastern parts of this country. Nile region, Karamoja sub-region, Lango sub-region, actually sub-region Teiso. The radio that is in the heart of Arua City, and we are on UBC Radio in the heart of Uganda's capital Kampala. We are also live and clear on Voice of Butebo that covers all western parts of this country, and Radio Butebo is covering all eastern parts of the country. Border to border we are connected, and we also live and clear on Magic 100 FM, which is also in Kampala. Streaming live on YouTube, just put UBC Ground Zero and you'll be part of the conversation. We do your views and also perspectives on this forum, and it is high time that you participate by calling 776-511-426, and you'll be able to share your views. Also connected to our important guest that we have in the studios of UBC. Josila Star is the CEO, coming from National Union for Disabilities in Uganda. We have James Mwesije is the member of National Council and Council of the Disabilities, and we also have Flavia Chomkawa, who happens to be one of the members and also coming from National Forum of People Living with HIV and AIDS Network in Uganda. You are most welcome from us on the other side of radio and online. Flavia?
Thank you very much, Amon. Am I heard?
Yes, very heard, and you are very clear.
Thank you very much for hosting us again, Amon, and I'm glad to co-present with my colleagues from the National Council of Persons with Disabilities. Like you have said, I'm Flavia Chomkama, and I'm glad to be here. I coordinate the National Forum of People Living with HIV networks in Uganda, and we are a coordinator of 135 forums. We have 18 national networks of people. National networks of people living with HIV, and we also have coordination for the same cities. The structures have been here for the last, I think, since HIV started. And among the national networks that we have are positive women with disabilities, and we engage definitely all the time with persons with disabilities living with HIV in ensuring positive health, leading to prevention, as well as ensuring that those who are HIV negative continue to be HIV negative, get HIV tested, learn what positive living from the negative angle is, and also live healthier and meaningful and sustainable lives. So this is the pre-World AIDS Day. We are celebrating World AIDS Day on Monday, and it's going to happen in Bushenyi, and we are already come here because we would like to make sure that the event goes well and that the country commemorates and remembers the 40 years of the HIV response and what we have gained, what we have not done well, but also remember those who have lost the battle to HIV over the last years. And so during this period, we have engaged as communities of people living with HIV, as recipients of care. We have engaged communities of carers who have supported us over the years. We have engaged and continue to engage to ensure that we continue to get to target the 95, 95, 95. And the first 95 is that all those people living with HIV know their status, and those who know their status, 95% of them are on treatment, and that 95% of those on treatment are immune suppressed. And by immune suppression, means that the virus has been is undetectable, and whenever people have undetectable viral load or virus in their blood, it means that they are able to, they do not transmit HIV. And so among all the other communities, we do realize that one of the most vulnerable communities are the people with disabilities. One, the gap we have there is that the people with disabilities are not really counted. We don't have size estimates. We don't know how many people living with HIV with disabilities exist. And it becomes difficult for the country to target this community when there are no size estimations, when we don't have the actual numbers of those with disability in need of HIV services as well as other services. We also realize that when we go to facilities, even when the health facility register has a column to indicate that people are with disabilities, this particular column is left blank. So whenever we are reporting in our national health information services, it's difficult to find the number of people with disabilities reported upon, or even their statistics are disaggregated because they are not there. So people are treated, but the numbers are not documented. So as a community of people with HIV, we have come up closely with the people, women with disabilities, and she has been engaging the disability fraternity to continue to raise the issue of invisibility. Because, Amon, you know, I hope I am still being heard.
Yes, you are
Amon,
clear.
that when you are invisible in the, it means you don't count. And you know, when you are not counted, it means there will be no investment. No wonder we have many more women and men with disabilities and their children on the streets, in our homes, who have not been targeted directly for these services. And until recently, the HIV Uganda AIDS Commission has in fact translated some of the information into ways, and you know, we are moving a step forward. We are still having a problem of sign language interpretation, accessing services by people with disabilities, and this time I'm talking about those with HIV. In my circumstances now, it's difficult. Without sign language interpreters, it becomes difficult to even provide services to these people living with HIV. And why I'm insisting on people with HIV is because this is the way we are remembering those who have gone. We are remembering how we have survived this year, and we are remembering how services, we are trying to talk of what has gone on in health service delivery. And therefore, it even goes without saying that with the funding cut that started in January, if we had any funds that were coming from the U.S. government, which we know has been supporting most of our vulnerable priority and populations, was cut, it means that the people with disabilities are very much at a disadvantage, because while they were marginalized and vulnerable, they are even further excluded from services, because services in the general outpatient clinic or the chronic care clinic are crowded. In some places, don't have sign language interpreters as well. In some places, we don't have RAM. In some places, we don't have people with disability-friendly health providers who understand this. But we are hoping that as we recover from the shock and as we start to stabilize with integration in the facilities, then along the way, we will have better services being delivered. But we are also imploring the government and the service providers, and we start the government in light of budgeting, that we need to have more budget for health, and particularly at this moment when we still are in disarray because of funding cuts, a little bit more for health and HIV services, prevention and treatment services. We know there is life-saving treatment, and we do understand that this year the budget was increased from 2.7 to about 5.9 to about 5.7 trillion, which is like double, and we appreciate. But the battle is still, we still have a long way to go.
Okay.
We are hoping that for the ministry, they have heard us and they know that we need to be part of the data so that we are counted and budgeted for. And finally, for service delivery, with the communities of people with HIV, we are working closely with communities to say, even when there is money, let's continue to support those close to us, to ensure they are not lost to follow up, to ensure we retain those in care, and ensure that those who are non-suppressed, we support to suppress, because we don't want any other person to acquire HIV because of the loss.
Flavia, that next week, Monday, we're going to be joining the rest of the world to commemorate World AIDS Day. But one wonders, as we celebrate and commemorate this important day, what are some of the achievements that we can talk about when we still have numbers increasing, new infections, and the numbers are affecting the young population between 15 to 24, when we still have numbers not being considered, especially those who are on treatment but not put in books. One would say we're still having a lot, even when we have started on this war 30 years back.
Okay, so thank you very much, Amon. Many times the good things do not come out very clearly, but we want to applaud this government, because as we speak now, 1.3 million people accessing antiretroviral treatment. We have health facilities across the country that are accessing ARVs, are providing ARVs, that are providing also the complementary services to people living with HIV and the general community. We have had an effort at educating communities about HIV, but we do know there has been, because of farming, a decline in the investment in information, education, and communication and behavior change, information and messaging. But we appreciate that the government has tried to put in place systems for ensuring that we have the ARVs, for ensuring that there is a supply chain, that medications are moving around the country. NMS is doing its best. I know it's also curtailed. The other beauty is that as we speak now, 94% of those living with HIV know their HIV status, and 90% of those who are HIV positive and know their status are on ART. They are in care. They are being supported and protected. And then we also know that 90% are immune suppressed. So we have, of course, this translates into the current 4.9 HIV prevalence, the decline in new transmission to 37% from 50,000 a number of years ago, and we also see a decline in vertical transmission or mother-child transmission, which has gone to 4,700. Of course, this is unacceptable that 40 years later, we still have babies being born, and that of the 37,000 new infections, 14,000 are adolescents and young people, and 7,000 of these are adolescents and young women. But you know, it is not only for Ministry of Health or Uganda AIDS Commission to manage this. We also see the annual police crime report saying we have 11,000 defilement cases. It's commensurate, really. It matches that where there is the defilement of 10,000 every year, you even have the adolescents and young people, 14,000 new infections. So it goes without saying. I think while the policy framework is in place, it's good, we are failing to enforce laws that ensure that we protect the adolescents and young people, the adolescents, young women and men, and we are not supporting them effectively to ensure that they have the right education. We see TikTok and the way people are bashing young people. We see criminal laws still in this country. We see, we know that the government has done a lot and has brought us a lot of support and services in the country, but there's still a gap. And for us, it is not the 95 we are looking at, because these are converted. We are saying, where are the 5%? They are the ones we need now to target, because they are the ones that are HIV positive.
Thank you, Flavia.
Yes.
All right. Your parting shots, please.
So my parting shot is that HIV is a national responsibility. For those of us who are HIV negative, please take care of yourself. And for those of us who are HIV positive, let us ensure that we access services, live positively, and HIV should stop with us. But to the government, we are saying, let us ensure that the integration of these services does not disintegrate the community systems, especially those people with HIV, which have stood 30 years, the set of time. They are at the national, at the district, at the sub-county, and in the parishes, in the support groups, and at facilities. Let us look out to these champions and leaders and peer educators, continue serving, and we see how to support them through the 0.1% that goes to the local government and other partners. The churches have income that they could pay and ensure that we sustain the gains that we have gained over the last 40 years. Thank you very much, Amon, for allowing me to be on this call. And a nice World AIDS Day for all of us. Let us pray for each other. And today we have a National Day of Prayer and Thanksgiving for people living with HIV, because we have overcome the pain this year, the emotional loss, the emotional pain of being in integration, and we were lost and frozen with a fanning cat. Wherever you are, if you are listening to us, please join us and pray with us and pray for us and our families, and also for the government to ensure that we sustain what we have started and ensure that less people die, and then we have less people acquiring new infections as well as prevent any more HIV stigma and discrimination. I thank you very much. Over to you, Amon. Thank you.
Thank you so very much, Flavia Chomkama, spending time to speak to us and updating us on the progress that has been made by this country, especially in the fight against HIV and AIDS. All right. Thank you, dear listener, for being part of us. And I'll now go back to the studios. But you can as well share your comments. Josephine here says that thank you for the program. I'm following here from Kawempe. There is a lot that needs to be done, especially in the fight against HIV, and the most vulnerable are those with disabilities. They face stigma double, and that needs to be considered and also be helped in our communities. Thank you, Josephine, and people of Kawempe there. I am Emmanuel. I am listening in from Paida, and thank you for the program. People with disabilities are being helped by the government, and if they really organize themselves, they'll be benefiting so much in these programs, because there is a fund in every fund of government. They're always considered, but some of them are not taking up their spaces. All right. Keep sending your messages and also call on 776-511-426. But before I go into that, allow me, as I will be reading your comments, I'll also go back to the studios. There is a very serious concern that I never wanted to skip my mind. Chozire and also National Council from UGEMS, Flavia brings a very unique mission here, that your people sometimes are getting services, others are not getting, but there is nothing to show. Because they're not always recorded, and that somehow lags behind the services and the progress that we need to engage as a community, as a government, because we deal with the statistics, and once we don't have the numbers, then how should we expect to be serving our communities? Chozire, is that a concern to you?
Yeah, it is. It is a big concern. We have made efforts to engage the Ministry of Health to see how they can edit their data collection tools, because that is where it starts. The health centers are not guided on who is a person with disability and who is not, but even in the data collection forms that they use, the ones we fill at the health centers when you go to access treatment or services, it does not have anywhere you write your disability or your category of disability. And that means that when this information is shared up to wherever it goes, to the last point in the health information management system, disability will be left out. And this is an issue for advocacy. We need even other stakeholders to come in and support us, because it seems our engagements are not yet yielding results. And yet we feel that if they know how many people with disabilities are coming to the health centers, they can easily plan for them. But also, if they know the type of disability that is visiting the health centers most, for instance, if there are people with hearing impairment, then they can say, let's see how to get interpreters at this health center. That is not happening. So the issue of data, today we are talking about HIV/AIDS, but it is cutting across all the sectors as a challenge. The other day we were engaging the Ministry of Agriculture and Fisheries, and this is the other issue that they also raised. They said, no, we are targeting persons with disabilities in our farming programs, but we cannot identify how many we have reached. So we said, how can we ensure that the M&E departments learn to collect data on disability? If they can capture the data on women, if they can capture the data on tribes, if they can capture the data on all the others, then it should be easy for them to capture data on persons with disabilities. Because it's not true that our people with disabilities don't have HIV/AIDS. They do have. And they are visiting the health centers. But if they are not identified as so, then the interventions cannot be easily tracked. And that requires everyone who is concerned to really take it as a priority and see how we can get the data for persons with disabilities.
Interesting. James, people with disability, HIV, how are we helping them? It is a serious concern. We are here stigma, and is it, Josephine, that they are being stigmatized twice? And it is your responsibility as leaders to protect them.
Amon, my CEO at Butebo has ably responded to some of those fears and what needs to be done. You know, the Ministry of Education pursues health in terms of prioritizing, by focusing on education, because that's what they say, prevention. But prevention can only happen if people are made aware, are given information, are given knowledge about these things and how they need to be dealt with. So it is incumbent on the Ministry of Health in its education programs, in its health disease prevention programs, to include all these aspects so that they are planned for and responded to in terms of training materials and capacity building of the health workers. Two, it is also incumbent upon organizations of disabled persons and those parties that work in disability to raise awareness of their people so that they can demand continuously till some of these things happen. And that's what the CEO Butebo was saying. They will continue engaging with the parties that are to make sure that at the end of the day, this thing is included in the Ministry of Health programs and work. Amon, when we talk about awareness raising in respect to disability and access to services, we are not doing it for persons with disabilities alone. We are doing it for everybody. Every day, when in the last census, but one, the population of persons with disability was at 12.4. Today, in respect to the last census, which also had its own issues on disability, we are told it is at 14%. So meaning the total number of persons with disabilities has gone up. And we know that as more new people get born, more people are recruited into work, more people retire and go, there is continuous need to continue raising awareness on matters of disability and how they are excluded and how they can be attended to. This is a continuous process, and I am happy that Amon, you have followed up on these things and you have invited us again to come here and talk about disability as we move towards celebrating the International Day of Persons with Disabilities. So my call upon all parties, but majorly Ministry of Health, Ministry of Education, and other sectors that are involved here, to come out and provide information and provide guidance and advise on matters of disability and HIV. Because you know men and you know their nature. They usually target women with disabilities because they think they are easy. Some think that actually for them they don't have HIV. And therefore they find ways of going there. But I want to tell you that we are also humans, and when our body calls, we respond accordingly because nature has its own dictates. So education, for me, education on these matters, but also a call to disabled persons. They need to come out because when given their economic situation, when these diseases come, they are the most impacted upon.
Interesting. More concerns coming in. Some places you talk about accessing health facilities, Amon, but these have become a big challenge to people with disabilities, especially those who cannot afford to have people to carry them, to direct them, and you find that we have issues to access those health facilities. Some of the buildings in Kampala have not been planned well to cater for all of us, and that is a problem. I'm wondering what the Nodipo and National Council are thinking about that when they go into those meetings. Chozila, are you able to answer that?
Yes, when we go in those meetings, we are not keeping quiet. We are talking. And talking is one thing, but acting is the other. We do engage, we do inform, we pull out policies and laws because our policies and laws are clear. We have a Building Control Act, which stipulates how the structures should look like for everyone, for the public. But many buildings still come up with no accessibility requirements. They will show you the plan and show that it has accessibility and it's going to be so beautiful. When the building is finally launched, you don't see any accessibility. And those are issues. So, on our side as Nodipo, we are engaging. We have a representative on the building control, on the building, it's called the Building Authority, I'm forgetting the full name, but there is someone who represents persons with disabilities on that board. And the purpose was to make sure that he or she continues reminding the policymakers at that board that persons with disabilities need accessibility. Even when they are going to monitor the new structures that are being constructed, we ask them to make sure that people with disabilities or that representative is part of the monitoring committee so that we ensure that accessibility is there. Some buildings have tried to take it upon themselves to make accessibility a must, especially the new ones. We only struggle with the old ones because the old ones will tell you the costs of breaking and then reconstructing, that money is not there. But also we have these others who are like mafias who will want to say, they will instruct their engineers, we don't have that money, so just make whatever is possible, because there's a belief that the ramps are more costly to put up as compared to the stairs. So the people with disabilities are sacrificed at that expense of saying, the other one is more expensive than this one, which we may not think that is true. The whole thing goes with planning at the beginning to make sure that all costs are covered. And what is interesting, many times when we are talking about accessibility, people think about the persons with disabilities. They forget about the older persons who may not be able to climb the stairs. They forget about the expectant mothers.
And they don't also remember that at any time they can be there.
Yes, we have found so many who are putting up their personal houses full of stairs. Then along the way they acquire diabetes. Before you know it, they are amputated. And they begin struggling with accessibility issues. So as we talk about these issues, we should not think about
they also get old.
Yeah, they also get old. But many of them, personal houses become a problem. So I think it's good that people change their mindset on accessibility issues, on inclusion issues. Today, we are talking about those who are already disabled. But what if anything happens tomorrow to you or to your family member? How do you feel? How will you struggle with this? And the more we become open-minded, the better. But the listener who has asked, we are not seated, we are engaging, but the response levels, especially on construction, is still a problem. We have even made efforts to engage engineers to say, look, we have engaged the architects, telling them we need to design structures that can make the buildings accessible. But the implementation of what the architects has put on paper by the engineers is normally another discussion. Thank you.
Interesting. James, let's also talk about the reforms that are needed. Both of you, I would also expect you to to participate in this, and I want to pick your minds and ideas on this. What reforms that are needed to ensure that people with disabilities benefit fairly from all the services, benefit from all the what we've been talking about. Uganda is their home and is their number one country. James?
Yeah. Before I talk about the reforms, Amon, allow me to add, and I am going to read verbatim what the Person with Disabilities Act says in respect to accessibility to buildings. Section 10, subsection 3, says an owner or a person in charge of a building to which the public is allowed access shall provide parking space for vehicles driven by a person with disabilities or by drivers of persons with disabilities. 4. The parking space referred to in subsection 3 shall be marked with a conspicuous sign or the acronym people with disabilities. 5. A driver who is not a person with a disability, who is not a driver of a person with a disability, shall not park a vehicle in the parking space referred to in subsection 3. 6. A person who contravenes subsection 3 commits an offense and is liable on conviction to a fine not exceeding 25 currency points or a term of imprisonment not exceeding 5 months or both. Now, I want to say that for us, we are already persons with disabilities. But there are people outside there in responsible positions who are supposed to be implementing this and ensuring that these issues are taken care of. And it appears nobody is listening. Of course, fines are provided for here, but giving people fines is a process. And people who are supposed to sit and engage or bring to book these people need to be facilitated. And the issue of budgets here is therefore very crucial. And you will find that a number of functions within the Act of Persons with Disabilities 2020 are not funded, therefore making it very difficult to get some of these things to be implemented. But the good news is, even those people in responsible positions who are not responding to these things, just like as intimated by my CEO at Nudipo, one day they will find themselves in a similar situation and they will not know what to do. So the call is for them to act now, because sooner or later they themselves or their relatives will join the club. Now, about what needs to be done. One, awareness raising must continue. We need to continuously talk to these people so that so that they understand that it is their duty and responsibility to work on these things. The other thing is that disabled persons don't need to keep quiet. They need to continue to talk. I'm a Christian, and my Bible tells me that keep on knocking, keep on asking, keep on demanding, and demand unceasingly. Then one time, a miracle will happen. So I am calling upon our people, the people who are supposed to be beneficiaries of all these services in place, all these offices in place, to continue to demand, to ask, and ask unceasingly. 3, we want to call upon government to budget, to plan and budget for these things. I do not understand why it doesn't happen, because the Equal Opportunities Commission has a requirement for approving all the plans and the budgets of state actors, state agencies in this country. If they do not approve on the basis of the plans not being gender and equity compliant, they are not supposed to be getting funding from government. So I do not understand how they go through and then at the end of the day they don't implement these things. I think we need to scale up to make sure that these provisions are budgeted for and are implemented as expected. And lastly, in this regard, in terms of the transformations that we want in place, is the monitoring mechanisms need to be included so that whichever document that handles monitoring and evaluation of their services to the people includes an element on disability inclusion.
Interesting. Chozira, what are your prayers?
For me, mine is a message to James and the National Council for Persons with Disabilities. Good enough now we have a bigger secretariat that is monitoring the work of government, that is mobilizing the different vulnerable groups, including persons with disabilities. But specifically to the council, they have a big role to do in monitoring the service delivery of government. We want to see the council doing more in terms of knocking at the doors of these service providers. Uganda AIDS Commission, where are our people? What is the problem? What can we do? What has failed? Because, Amon, the policies are there. The laws are there. James is reading you some of them. They are very clear. Our challenge is how do we enforce these policies to give us the results we want to see. As I told you, we are engaging the government officials. We are training disability inclusion. We are creating awareness to the persons with disabilities. Many people with disabilities, if you went to the communities, at least they are aware. Their only challenge is where do we get the information? But at least they are aware that we need to participate. We need to be there. But if they are not mobilized to come, that is a challenge. So if the council can support us in ensuring that these responsible centers, the review board in charge of construction, the AIDS Commission that is supposed to make sure that services reach people with HIV, AIDS, the Ministry of Health that must ensure that the data collection tools are clear, and even the other ministries, we shall see progress. Because many of them, they say, yes, we are here, but we don't know what to do. We are even aware that people with disabilities are there, but we don't know what to do. So it could be our government body to support, and maybe for us as NODIPU to continue engaging and advocating and amplifying the voices of the issues that are affecting persons with disabilities. But the other thing that needs to happen, on top of what James has said, the reforms in practice. Reforms in practice. Someone goes to access a service, but because someone says, I've never dealt with a blind person, the next thing they'll say is, maybe you go to NODIPU. We have seen that a lot in civil society. Someone has a legal matter that just requires legal interpretation, but instead of getting the service from this legal aid service organization, as long as they see them living with a disability, the next thing is go to NODIPU. So they don't care whether NODIPU has legal services or not, but just because they feel for them they are not good enough in handling issues of disability, they leave them out, which is wrong, because we keep saying that I'm a person first before I get a disability. So that means that the issue that affects any other person can affect me also before my disability is seen. Because if I'm saying my land is being grabbed, it's not about my disability. My land is being grabbed just because I have land. The same way they would grab land for the other person. But the practices, the mindsets, the pre-perceptions about disability is our problem.
Okay.
And that has made it very difficult for policies to be implemented, even when they exist.
Thank you. Time is not on our side. I would ask Jazila to give your parting shots, and James will conclude.
Okay, so I want to thank you, Amon, for again inviting us to speak about disability. It is always something that makes us happy when we create awareness, when we talk about these issues that affect us. And as we go to celebrate the International Day for Persons with Disabilities, let's think about financial inclusion and wealth creation for persons with disabilities. It's the only way people with disabilities continue getting empowered. When they are empowered, the stigma and discrimination reduces. Thank you.
James?
Once again, to thank you for inviting us to be here to talk to the public and other parties. My call is that to everybody is to go to Muvende on 3rd December and celebrate the gains that we have achieved as a movement and as a country and as a government, and to, in so doing, to justify continued support and engaging with others to protect the gains that we have made so far, like I said. And I would want also to ask people with disabilities outside there that the only way we can be a force to be reckoned with is to build our capacity. So go to school. Children, go to school. Those who are younger adults and adults, go out and acquire more knowledge, acquire more skills, attend workshops organized by government, non-government actors, so that you build your capacity to engage with the parties that are. For those who want to improve their income levels, find some income-generating activity. Do and engage with it, so that you are seen to be doing something. And in so doing, you will start building your confidence, your self-esteem as a contributor and as someone that is working towards improving his or her quality of life. And scale up your financial literacy. Financial literacy is one important thing that you need to know, so that you know how to manage the little money that is coming in and how to invest it. And lastly, like I said, keep on knocking, keep on asking, and keep on interacting with those that matter, those that provide services, so that you remain visible, because out of sight is out of mind. Good celebrations for the Persons with Disabilities Day on 3rd December. Thank you very much for listening.
Interesting. That brings us to the end of our discussion. I want to thank you in a very special way, Chozira and also James, for making time to come through and inspire the people of Uganda on UBC Radio, UBC Butebo, UBC Western Nile, UBC Magic 100 FM and Voice of Butebo, and those that have been with us online on YouTube. That is the UBC Ground Zero family there. As we come close to this important engagement, I want to extend my deepest appreciation to you all, our dear listener, those who contributed to this program, and also our dear guests for making time to come through. Your insights have reminded us that inclusion is not just a favor, it is a right, and that is the true development cannot be achieved when any member of our society is left behind. And I want to believe that we picked a very good information, good lessons, and also picked a leaf from what we discussed, especially to do with people with disabilities in Uganda that deserve policy statements and also deserve action, access, and accountability, but also those who are affected by HIV/AIDS. I am glad that we have been able to score some goals and also have some achievements. How I wish, like James, you rightly put it, we protect those gains. Until next time, same station, same program. Ampaire Amon Buteega is my name. For God and my country. Different programs are coming your way on different radio stations that have been live and that cover UBC Ground Zero family. For God and my country, allow me now to sign out. It's a very good day here.
That was Ground Zero Season 2, a production of Uganda Broadcasting Corporation, UBC, inspiring Uganda. It's hot.
We passed it. We didn't know exactly what the problem was on the ground. There is no pretending about the effect of this thing. There's no pretending about it. Nobody should. It's a problem.
It's balanced.
This is not the stage at which you start planning to tax a commodity like coffee, especially from down there.
It's intellectually engaging.
The Constitution provides that the land must be registered under the customer tenure system, which is one of those that's recognized by the Constitution.
Ground Zero Season 2, live and syndicated on your public and national broadcaster, UBC, inspiring Uganda.
This is UBC Radio. Tune in for news.
At UBC Radio, we bring you Uganda's latest news and information.
Focus on Parliament.
What we need to do, the Prime Minister must give us the position before we finalize with the budgeting process.
Enjoy sports. The environment. politics,
The mission we have is socio-economic transformation.
health, entertainment, updates in education, on the farm. Keep tuned into UBC Radio,
Don't
inspiring
miss
Uganda.
UBC Radio Ground Zero every Saturday from 10 a.m. to 12 p.m. We host credible and relevant guests to discuss pertinent issues of national importance aimed at addressing people's concerns.
As a country, if we don't fight this vice of corruption seriously and with honest opinion without any bias, things will not be good for us.
UBC Radio Ground Zero, right here on UBC Radio.
UBC, ensure that the information you give out is factual but also objective, balanced, and complies with the legal and policy requirements for the media.
Ground Zero program is always live, loud and clear, every Saturday from 10 a.m. to 12 p.m. on UBC Radio, Butebo FM, West Nile FM, and Magic 100 FM, and live stream on YouTube. You can also listen to the repeated